start it.
Hi guys, today on the Nurse's View we're discussing the topic of concussion. We have myself, Kelly, Lisa, Christine, and Kim, all nurses, along with our guest speaker, Jake McIntosh, who was a patient in our trauma center not long ago, and he's going to tell you what happened to him.
So what happened was I got down to the motocross track and I hit a tabletop and I overshot it and I landed on the bike, but when I fell off I got knocked out because the bike ran me over. And that's about it.
So Jake presented to the trauma center via fire rescue. When he did fall off his bike, he did have a helmet on, which was good. Good job for wearing a helmet, Jake.
Yep, good job. Good job.
However, it did knock him out because you can receive a concussion whether you have a helmet on or not. En route, he did vomit several times. When he arrived to us, he had a backboard on and a cervical collar. We brought him into the trauma bay. The team was there. We exposed him, put the monitors on, started IVs. He had a Glasgow Coma scale of 14 because he was lethargic. We applied oxygen just for precautionary purposes. Got the team all there. We assessed him, determined that he probably more than likely suffered a concussion or some type of brain injury from hitting, since his only complaint was the vomiting directly after the incident and the fact that he had a severe headache. After we got all of our initial stuff done, the monitoring, the IV, the doctors ordered some x-rays, chest x-ray to rule out pneumothorax or hemothorax, and then we got an order to go to CT so we could scan his head to make sure his brain was okay. At this point, we're going to go over some critical questions that we would be concerned about with Jake and his condition.
Okay, guys. First question. What is the pathophysiology of acute concussion?
A concussion is defined as a biochemically induced transient disturbance of neurologic function that may or may not be associated with loss of consciousness. Additionally, there are no universal definitions of a concussion. Why should the assessment focus on the neurological status?
It is important to be cognizant of the fact that although the radiographic studies may be useful in the evaluation of a head trauma, they will be negative for concussion with no other injuries. Indications for ordering a CT scan include focal neurologic examinations, findings, signs or symptoms of increased intracranial pressure, GCS score of less than 15, and seizures related to trauma.
And this is part of some of the evidence-based practice guidelines. After the initial assessment of the patient, we suspected acute concussion, and basically it was due to the continued signs and symptoms. Jake, he remained sleepy. He was arousable but easily agitated. His Glasgow Coma scale continued to be a 14. He answered questions. His pupils were equal and reactive to light at 4 mm's. He continued to complain about some blurred vision, and intermittently some vomiting occurred. He did report a headache of 8 to 10 on the pain scale. So at this point, we did a comprehensive neurological assessment, and some of the things that included: mental status, delayed responses, emotional changes, which in him we saw the agitation, his pain, the 8 out of a 10 on the pain scale for headache, visual disturbances, which were seen in the blurred vision. He was had some amnesia to the event. signs of increased intracranial pressure we would want to look for. His physical assessment basically included everything: his appearance, his head, his neck, his face, jaw, nose, presence of any drainage from his nose, his ears, his strength, his sensation, coordination, balance, pupil assessment will continue. Vital signs, we will continue to protect his C-spine with a collar, C-collar in place, and a backboard until we cleared his spine, and put him in a reverse Trendelenburg to relieve some of the pressure from his brain. Pain assessment, we'll give an analgesic. No narcotics at this point because we won't want to mask any neurological deficits or symptoms. Give him an antiemetic for his nausea and continued vomiting. Definitely put him on a seizure protocol and ensure that the radiologic tests are completed to rule out any serious condition. Any of these findings, any significant findings, of course, would definitely go to the provider, and as well as neurology would be on for consult. Here are some other questions, critical thinking questions that we'll address for this section.
So what are the evidence-based practice guidelines?
Computed tomography or CT imaging should not be used to diagnose sport-related concussion, but might be obtained to rule out more serious.
TBI, such as in intracranial hemorrhage in athletes with a suspected concussion who have loss of consciousness, post-traumatic amnesia, persistently altered mental status, GCS less than 15, focal neurologic deficits, evidence of skull fracture on examination, or signs of clinical deterioration.
And Jake is a wrestler, so one of the things we were concerned about is him getting back, or one of the things Jake was concerned about was him getting back to his wrestling once he healed from this concussion.
Okay. So what would be a prime priority, medicine or neurological exam?
The neurological exam is the most important diagnostic tool for acute concussion. Overall, no medical therapy is usually prescribed for patients after an acute brain injury. Pain control is usually achieved with over-the-counter medications, such as acetaminophen. Avoid narcotics so that clouding of the patient's mental status or neurologic exam does not occur. Also, aspirin is not recommended until hemorrhage is ruled out.
Again, this is some of the best evidence-based practice guidelines. We move on to stage 3, where severe conditions were ruled out by all the radiographic exams. Diagnosis of acute concussion is basically what we have diagnosed him with, and discharge planning is now in progress. So he's monitored in the trauma center until these symptoms subsided, or he was free of the symptoms of concussion and returned to baseline. So at this point, his neurological assessment returned to normal. His physical assessment was normal. His vital signs remained to be stable. Initially, he was a little tachycardic, and that has come back down within normal limits. He is denied pain at this point. There is no blurred vision, no vomiting since last being medicated. His labs were normal. All of his radiographic exams were normal. And at this point, we're educating the patient and the family on the symptoms of concussion. Progressive activity is the focus of this education, and he's discharged home with his mom and dad with a follow-up to his primary care physician.
The discharge instructions are really important when we send a patient home with a concussion. Some of the things we would address to the patient and the family member is that they need to be carefully watched for the next 24 hours. If the patient was to have any symptoms like excessive sleepiness, they're unable to be woken up, excessive nausea, vomiting, severe headaches that's not controlled by Tylenol, change in their personality, change in their balance, they're unable to get up and walk, they're not wanting to eat, they have no appetite, All those symptoms would be very important and could warrant an emergency, and they would need to report to their nearest emergency room. After Jake left, how did you feel? Were you feeling okay at home? Did you
Yes.
have any of those symptoms?
I was feeling fine after I got home.
Okay. Did you have to take any medication?
Yes, after I got out, I took a little bit of Tylenol every
Okay.
once in a while.
Okay. Another thing we would be telling young kids like Jake is that they could not have any contact sports for at least a couple weeks until they had a follow-up and were cleared by their physician. That's very important with kids in active contact sports because repeated incidents of concussions have been linked to traumatic brain injuries in athletes. So have you come back to wrestling yet?
Yeah, after the certain amount of weeks was up, I did come back wrestling.
And everything's going well?
Yeah, it's going well.
Okay, good.
Did you remember your accident?
No, man.
Well, sometimes that's a good thing.
Yeah. Do you remember your fabulous nurses?
No.
Okay, so let's pick your brain a little bit. What post-concussion symptoms require immediate medical attention?
Okay, so like Kelly had mentioned before, they cannot be awakened, seems increasingly sleepy, excessive vomiting, seizures or a fixed stare, dramatic mood swings, irritated, sad or agitated, blurred vision, confused and not speaking clearly, blood or clear fluid draining from the nose or the ears, increased headache and neck stiffness, unequal pupils, trouble walking, or dizziness.
And for our last question,
Yes.
when is it safe to return to routine daily activities?
So we like to look at the 6-stage approach from this. Rest to unrestricted activity. Progression is measured across physical, cognitive, and vestibular domains. Utilizes the neurobehavioral symptom inventory for symptom tracking. Resting heart rate and blood pressure are used as physiological measures to evaluate activity tolerance.
And that concludes our show today on the Nurse's View. Thanks for having us.
Thank
Thank
you.
you.